इधर कर दे. So today we are going to talk about macular degeneration. It's known as age-related macular degeneration. This happens in retina. Macular area is a small central area. In that area is the maximum vision because maximum visual cells known as the cone cells are there. That's the reason this is known as a macula, and there is a degeneration of the macula. Usually it is after 60 years. Now, what are the symptoms of macular degeneration? See, whenever there is a normal vision, the visual acuity is very good. But in this condition, in early stage, whatever you are seeing, you will, for example, a straight line is seen as a curved line. That is one. As the stage progresses, you will see the central scotoma. What is a central scotoma? Where in that area you will not see. Especially wherever you are focusing, you will not see that spot and you will see just the peripheral area. So this is about the symptoms, and slowly the vision will be reduced as the disease progresses. Here there are the types of macular degeneration. One is known as a dry macular degeneration and other known as a wet age-related macular degeneration. In case of dry macular degeneration, there's a protein deposit at the macular area, and usually it is not a progressive condition. And the symptoms are, of course, it will reduce vision. Well, in wet AMD, it is related with the new vessels are formed in that macular area, and the new vessels, they leak. And because of leakage, there is a macular edema. There is a swelling in that macular area. Here you can see one area where you can see, for example, this image is seen by the patient like this because the central area is not seen, but the peripheral area is seen. This is, especially you will see this symptom in case of age-related macular degeneration. Here above you can see the healthy macular area. Here you can see the dry part. This dry and wet you can only differentiate whenever fundus examination is done by a specialist and by OCT. How to find out this? In early stage, you can just find out by Emsler grid test. This is Emsler grid test where the patient is supposed to see in the center with one eye, and he's supposed to tell you whether all these lines are straight or it is little curved. For example, here you can see this patient is seeing central part is not seen, and other lines you can see they are all not regular straight line. They are seeing as curved lines. So this happens in case of early symptom. And to confirm this condition, you have to do OCT. What is OCT? It is known as optical coherent tomography, where the image is seen and you will see that there is a macular edema in that area. and you will be able to find out whether it's a wet or it is a dry type of macular degeneration. This fluorescent angiography, no need of doing. Nowadays, nobody does. So what is OCT? Here you can see the OCT. This is a normal OCT where you can see all the layers of the retina. It's all continuous here. While in this condition, age-related macular degeneration, you can see here all these layers. See, from here only you can see the new vessels they form at the choroid and they push the mid-pigmentary epithelium. And your black part you can see this is a leakage of the blood vessels, and you can see this fluid. This is a macular edema. This is regarding the age-related macular degeneration, and it's quite common. And allopathy, they give injections in the eye, intravitreal injection, anti-VEGF. Many patients, they have to go on giving injections and still there is a progress. And side effects of this injection or the complication, hemorrhage and infection, about maybe less than 1%, but they can get this infection, and whatever vision is there, they will lose the vision. So whatever is the best to the patient, we should do. So this is regarding macular degeneration. Thank you very much.
Okay, I hope you can hear me and see me okay. So I think, Dr. Pushpa, you already spoke about macular degeneration and the whole idea about the clinical pathology, what it is. Yeah. So we are going to talk about the homeopathic approach in it. And for homeopathy, actually, whether it's a case of cough or a case of cancer, the approach still remains the same. The idea still is to individualize the case. The idea still is to find the remedy for the person in the disease and not the disease only. One of my teachers recently gave me a very beautiful kind of line that helped me a lot to understand disease. And he told me that what we traditionally see as a disease, which is the end product of the symptoms, whether it's a degeneration, whether it's an ulcer, whether it's a whatever it is, it's an end product of the pathology. But in homeopathy, you have to focus at much before the end product of the disease, much before, when there are functional symptoms that come up, when there is a dynamic disturbance before the functional symptoms that come up. That is the area that you have to tap as a homeopath. You have to understand the progress of the disease, how the evolution of disease actually formed. Understanding that will actually help a homeopathic physician to find the remedy for the person. What can the homeopathic physician do? So the idea of the homeopath would be, when he takes the case, he will try to go at a deeper level, try to understand the person's entire journey from childhood to adulthood, how he reacted in different situations, what was his perception of reality, his difficult situation, and how he responded in them, his fears, his anxieties, his dreams, his stresses. We try to tap at basically at a subconscious level. Along with this, his constitutional symptoms, which means that he or she is affected more by heat or cold. What is a particular craving? What is the aversion? Where does he sweat? When does he sweat more? If it's a woman, how are the periods? What happens before, during, after the periods? So on. Also, importance of family history. This also gives us a lot of idea about the deeper miasm in the patient, which can help us to find a remedy for the person. Generally, the idea of homeopathy also is, in many of these age-related macular degeneration cases, and many of these cases are now turning towards homeopathy, there are some very good results where we can slow down the pace of the disease, the degeneration, also prevent the complication. In some cases, also stop the progress of the disease. Generally, the idea is to individualize. However, there have been certain homeopathic remedies which have been very, very useful. One of the commonest important group of remedies, which I'm going to now just give you an idea so that you all are kind of also, many homeopaths will be watching this video a little later. Very often, the group of remedies which I have seen being very, very useful, helpful, and commonly indicated is the Ophidia group. That is the homeopathic remedy prepared from the Ophidia, the Lachesis, the Crotalus horridus, the Crotalus cascavella, the Botrops. Typically, Crotalus horridus is one of the most commonest remedies I've used. The other group of remedies which I've used also is remedies from mineral kingdom. Remedies like Plumbum metallicum, Aurum metallicum. Remedies where there is a very high sense of responsibility, very high sense of pressure. So much responsibility, so much of pressure that for so long, many years, many decades, that affects the person's general health, can affect the degeneration of the nerves. And that's where very high kind of remedies from 5th row, 6th row, mineral kingdom, the argentums, the strontiums, the barytas, the aurum, the plumbum, the mercuries, the thalliums. These are important group of remedies which can help. So all in all, homeopathy definitely has a beautiful approach in age-related macular degeneration cases, and in many cases. Remember, one of our masters once said, Dr. Fatak, till there is life, there is hope. So in any kind of cases, definitely homeopathy has a role to reduce the suffering for the patient. So with this, I would like to invite all of you to kind of spread the benefits of homeopathy for eye-related patients. Here, I would also like to add, in our clinic, we have added two of very important things that along with homeopathy, we add certain lifestyle changes, certain changes with the dietary changes, certain changes with certain exercise routine. And when they are done together with homeopathy, beautiful. That is the best chance of healing for the person. Depending on the individualized case, maybe it's an ophthalmic case, depending on your constitution, we will suggest a particular nutrition plan for you, which will go in tandem with the homeopath. So that's all from us today from here. Just an idea to share about the benefits of homeopathy and integrated treatment along with the allopathic doctor, along with the nutrition treatment, along with certain exercise and yoga routines that can help you. So take benefits of this, share it with as many people as you can, and my very best to you. Thank you. You have all the details below, the email ID, the contact numbers if you